in Gen Health News this morning. Now, last year, Spectrum Health was one of several prestigious healthcare organizations to receive a grant from the National Institutes for Health to help lead the largest U.S. research program on precision medicine. Steve Heacock, he's the Senior Vice President of Public Affairs and Research, is here to tell us more about how you can be part of making some history. Good morning, Steve.
Well, good morning. Delighted to be here.
Oh, we're glad you're here. First, the phrase precision medicine. Explain exactly what that means, because I'm not sure I fully understand. What does precision medicine mean?
No, I'm happy to, and just delighted to be here to share what's going on at Spectrum Health. There's always a lot going on.
There certainly is.
Precision medicine really denotes the gathering of information that's available now that wasn't before. So doctors forever have tried to treat you as well as they could as an individual. So they took your history, they looked at what you do as a hobby, where your habits are, where your environment is, and they try to apply then medicines that apply to whatever's ailing you. Okay. Well, they were lacking a tool that we now have, and that's genomics. And so now having your genetic makeup allows a physician and others to even get more precise in their treatment of you.
I understand.
And so particularly with drugs, with a prescription of drugs, most drugs we know will affect positively 75% of the people they're given to. Well, that's a big leeway there, and sometimes you're not absorbing that drug, and it's not impacting you in the way that you would hope it might.
So 1 out of 4 who are getting that medicine aren't getting the treatment that they really need because of, well, it could be something genetic. So there's this research program called All of Us. Right. Okay, the All of Us research program. It's a pretty big program.
It's the biggest research program, I think, in the history of the United States.
Wow.
And probably the world. It's going to, the goal is from Francis Collins, who is the director of the NIH. He was the guy that ran the Genome Project years ago.
Yeah, okay.
Brilliant man, wonderful man, actually has West Michigan connections. But Francis Collins decided that if we could take 1 million or more people, gather the data from them, not just genetic data, but also their habits and their environments and what they eat and who they are and where they come from and how they live. If we could gather all that data together, we'd have this incredible source of information to find cures in the future.
Absolutely. It makes a lot of sense. The more information you have, the better you have at getting the right treatment to the right people. So how in the world can we get involved and be a part of this history-making research project?
Yeah, first of all, we were very excited that Spectrum was chosen to be part of the grant. Mm-hmm. We're only one of some 22 centers around the country that are participating.
Okay.
And what it means for the people of West Michigan is that they can, in fact, enroll in this study or have the opportunity to. Okay. The requirements are they need to be 18, they need to be live in the United States. Okay. They also need to have been a Spectrum Health patient at one time or another. Okay. Given the size of Spectrum Health, that could be a blood test. It could be physical
something as simple as a blood test.
Sure.
Okay.
And so most people in West Michigan have touched this in one way or another.
Be 1 in a million. You see the requirements right there on your screen, and I do believe we had a screen also of the benefits of being a part of this. So if we could bring that up again as well. So if you right there, you have access to study information and data about you. That's always good to know. The more information you know about yourself, I mean, the people who are going to take part of this research study, they get to learn more about their own history.
That's exactly right. In fact, this study's unique in that regard that we've learned from our past. In the past, sometimes studies have used people as just subjects. Now they're being treated as partners in this study. And so not only will they have access to their own data and the information around them and how that's improving things, but they can help improve the program with suggestions. They'll be asked as they go along through the program, what they think, how they think it might be improved, et cetera.
Excellent. So benefits for you personally joining, and of course the greater good, the greater benefit of being part of this research program. So I'm interested. I want to be part of this. Yeah. So what's my next step? If I'm watching this right now and I think I'd like to be a part of that All of Us research program, what do I do first?
Yeah, well, let me first, you're right about the greater good, and that's really what it's about. Right. It's not about, this study's not about you yourself. It's about the generations to come and how, in fact, we might improve care for them as we go forward. And people in West Michigan are incredibly generous in that regard. We've had 5,000 people in studies over the last 3 years at Spectrum, for example. People are willing to do that. They want to help. The way to get involved is to go to our website, and the first step is you take a little survey that takes a couple minutes. And then you're assigned a code because, of course, privacy is incredibly important. And and everybody is sensitive to that.
Oh, especially when it comes to genomics. You hear that word, you
right.
definitely want privacy.
That's exactly right. So once that code's applied, then further discussions occur, deeper surveys occur, and then finally the physical, some blood tests and tissue taken and that kind of thing. And so then it goes forward from there.
Yeah, nothing too invasive, pretty simple, basic stuff.
Yeah,
right?
yeah, pretty basic. And it's not, our numbers are limited here. We're asked, I think, to bring in 3,000 people in the first year. So it's not as if we need hundreds of thousands of people here in West Michigan, but we need a real diverse group of folks, any gender, any sex, any sexual preference. None of it, all of it matters. They all need to be included in the study because we need the data on, in fact, how different backgrounds impact people's health.
Yeah, your data set needs to be varied, absolutely. Well, thank you so much for the information. So appreciate you being on the show and telling us about this. Again, you can go to the website if you'd like to get more information about being a part of that study. I do believe the website right there on your screen, spectrumhealth.org/allofus, or call that toll-free number 833-564-6255 and be a part. Maybe you could be part of the All of Us research program. All right.